Hello, good morning. Greetings from Texas, United States. This is probably the best occasion to announce the website of the oncoming summit conference on cancer prevention, early detection, comprehensive cancer treatment, and rehabilitation, a program being designed combinedly by the Government of Kerala, the private hospital systems, the non-governmental organizations, and well-wishers. Right now, I think everyone is concerned about the drastic changes occurring around the world, and more, the geopolitics is teaching us the days of globalization are gone. Each country has to stand on its own legs. We may not be able to look towards the West for guidelines, technical assistance, financial assistance, or leadership. That is precisely the reason a movement like the one we have on the anvil is assuming more and more significance. In order to conquer cancer, we now realize that early detection and prevention are perhaps the best ways. We proved it in Kerala. By cutting down or abolishing cigarette smoking, we brought down the incidence and mortality from smoking-related cancers. By adopting better personal hygiene and having the human papilloma virus vaccine, we cut down the incidence and mortality from cervical cancer. By accepting the hepatitis B vaccine, we now have succeeded in bringing down the incidence of hepatocellular carcinoma. Recent studies have shown that if you check arsenic in drinking water, we can bring down the incidence of bladder cancer. So the chances of preventing more and more lethal cancers are right there in the horizon. What else can we do? The early detection will bring down the cost of cancer treatment. The majority of people go bankrupt by meeting the expense of modern cancer therapy when the disease comes in the advanced stage. You know about the cost of immunotherapy, which runs into lakhs and lakhs of rupees, the bone marrow transplantation, the CAR therapy, chimeric antigen receptor T lymphocyte treatment, which has already arrived in India, costs about 10 to 15 lakhs per treatment. So how many people can afford this? And thus came the new title of financial toxicity. The reason why we have this financial toxicity is because we wait too long until the cancer is far advanced. So the new project, which we launched on February 4th this year, thanks to the initiative of Kerala government, for the first time in the history of Kerala's health services, to meet a common enemy and to fight our everlasting challenge of cancer incidence and mortality in Kerala, the Kerala government joined hands with the private sector. The Chief Minister and the Health Minister together came and graced the occasion on 4th of February, and we have now a movement to combine the public and the private sector in our battle and the ultimate war against cancer. This is great development in a state which already hit international headlines by Kerala model in the past, all because of the concerted effort of subsequent governments, the public, the media, and family members, particularly women's education. So we're going to try the same pattern for cancer prevention, early detection, comprehensive treatment, and rehabilitation. The most exciting development is we have a dream. We have a dream that in 5 to 10 years, there shouldn't be no out-of-pocket expenditure for a cancer patient. We are thinking about designing a comprehensive cancer care insurance with the advice from experts in actuary, insurance industry, and business management and all. And we have already approached some of them, and their response is quite warm and encouraging. So once this summit is over, we will start focusing more on preventive measures, early detection programs, and within the next 2 to 3 years, hopefully, we will launch a comprehensive catastrophic health insurance, which will start with comprehensive cancer care insurance. The goal is plain and simple. No cancer patient will have to pay out of pocket for the cancer care. If this pilot project succeeds, Kerala can expand that into other areas of human distress. So I congratulate the organizers, especially for lining up such an eminent galaxy of experts from a variety of fields. And we are lucky that we are getting full support from the Mayo Clinic, Minnesota in USA. In fact, this website is being launched by the Mayo Clinic Cancer Center director who just stepped down, who has offered to help us in whatever way we want him to do that. We are very friendly and cooperating with the Tata Memorial Hospital, Mumbai, and they are sharing their expertise. We have our contacts with ICMR and Government of India to make Kerala the model state in cancer prevention, early detection, comprehensive care, and cancer survivorship. It should be said to the credit of Kerala that about 4,000 children are cancer survivors, and their problems are unique and very challenging. Hopefully, in a few years, when we win the battle and eventually the war on cancer, this will be the next Kerala model for the rest of the world to emulate. I congratulate the organizers and I wish you all the success. Hopefully, I will join you in January for the summit conference. Thank you.